Hello, my name is Kaylee Chavez, and I'm going to be presenting my presentation over hypothyroidism. Okay, hypothyroidism defined. It is an underactive thyroid gland. Hypothyroidism means that the thyroid gland can't make enough thyroid hormone to keep the body running normally. People who have hypothyroidism have too little thyroid hormone in the blood. Common causes are autoimmune diseases such as Hashimoto's thyroiditis, surgical removal of the thyroid, and radiation treatment. Some signs and symptoms are going to be cold intolerance, loss of eyebrow hair, arthritis, slow heartbeat, dry hair, menstrual disorders, forgetfulness, fatigue, brittle nails, constipation, weight gain, forgetfulness, dry skin, depression, infertility, and muscle aches. When thyroid hormone levels are too low, the body's cells can't get enough thyroid hormone and the body's processes start slowing down. As the body slows, you may notice that you feel colder, you tire more easily, your skin is getting drier, you're becoming forgetful and depressed, and you've started getting constipated. Also delayed puberty or slow growth, hair loss, brittle nails, enlarged thyroid, high cholesterol, sexual dysfunction, slow heart rate, weight gain, and irregular uterine bleeding. Because these symptoms are so variable and nonspecific, the only way to know for sure whether you have hypothyroidism is to get a simple blood test for TSH. Okay, some diagnostic tests include medical and family history. You should tell your doctor about changes in your health that suggest that your body is slowing down. If you ever had thyroid surgery, that's very important. If you ever had radiation to your neck to treat cancer as well. If you're taking any of the medicines that can cause hypothyroidism, such as amiodarone, lithium, interferon alpha, interleukin 2, and maybe thalidomide. Or you can also notify your doctor if any of your family members have a thyroid disease too. And also some diagnostic tests continued. You're going to need a physical exam by your doctor. He will check your thyroid gland and look for changes such as dry skin, swelling, slower reflexes, and a slower heart rate. And you'll also get blood tests. There are two types of blood tests that are used in diagnosis of hypothyroidism. One is TSH, which is thyroid stimulating hormone test. This is the most important and sensitive test for hypothyroidism. It measures how much of the thyroid hormone, thyroxine, T4, the thyroid gland is being asked to make. And a normally high TSH means hypothyroidism. The thyroid gland is being asked to make more T4 because there is enough T4 in the blood. And another test is T4 test. Most of the T4 in the blood is attached to a protein called thyroxine binding globulin. And the bound T4 can't get into body cells. Only about 1 to 2% of T4 in the blood is unattached, free, and can get into cells. The free T4 and the free T4 index are both simple blood tests that measure how much unattached T4 is in the blood and available to get into the cells. Some common medications include levothyroxine, Synthroid, Armour-Thyroid, Lavoxyl, Cytomel, Tirosint, Natrethroid, lithiothironine, thyroid desiccated, Westeroid, and over here is some more common medications. And here are the risks of not taking your thyroid medication. With hypothyroidism, you're going to get elevated cholesterol, low body temperature, increased risk of heart disease, and depression. And then here in the middle is the mixture in between hypothyroidism and hyperthyroidism. Whenever you're not taking your medication, and those include muscle weakness, inability to lose or gain weight, and enlarged thyroid. Okay, so nutrition. While diet cannot cure hypothyroidism, it plays three main roles in the managing of the condition. Foods that contain certain nutrients can help maintain proper thyroid function, such as iodine, selenium, and zinc. Some common foods that have iodine in it are cheese, milk, ice cream, iodized table salt, saltwater fish, seaweed, and whole eggs. Some common foods that have selenium are Brazil nuts, tuna, shrimp, beef, turkey, chicken, ham, eggs, oatmeal, and whole wheat bread. So if you eat eggs, you're going to get some selenium and iodine. So it's pretty cool. Some zinc-rich foods include oysters, beef, crab, fortified cereal, pork, chicken, legumes, pumpkin seeds, yogurt, and those are some examples. And so other foods interfere with normal thyroid function, such as those containing glycogens and soy. So limiting these can improve symptoms. Some foods and supplements can interfere with how well the body absorbs thyroid replacement medicine. So limiting these foods can also help you. Hypothyroidism can lead to weight gain, but because it can slow down a person's metabolism. A person's hypothyroidism should aim for a healthful diet and help to prevent weight gain. So what's most important is making dietary changes, and it can have an impact on how a person feels and may help improve their quality of life. And so I have a couple of questions for you, and I'll read them out loud and give you some time to answer them. So question 1, Nurse Susan is teaching her patient about the signs and symptoms of hypothyroidism. Select all that apply. So you have 1, hair loss, 2, weight loss, 3, fatigue, 4, brittle nails, and 5, bradycardia. And I'll give you some time to answer. Okay, and the answer is 1, 3, 4, and 5. And the rationale can be found on page 796 on chapter 39, I believe, in your med-surg book. Question 2, Mrs. Smith was just diagnosed with hypothyroidism. She asked the nurse which medication she has prescribed. The nurse responds with A, levothyroxine, B, lisinopril, C, heparin, and D, metoprolol tartrate. Oh, excuse me. I'll give you some time to answer. All right, I'm gonna go ahead and show the answer, and the answer is gonna be A, and you can also find that on page 796 in your med-surg book. All right, moving on to question 3. Nurse Susan is reinforcing teaching about nutritional intake to help maintain proper thyroid function. What is one of the foods that she listed? A, kale, B, frozen dinners, C, turkey, or D, potato chips? And I'll give you a little time. All right, and the answer is gonna be C, and you can also find that on page 796 in your med-surg book. All right, question 4. Mr. Time, just recently diagnosed with hypothyroidism, asked his nurse what symptoms he would have if he would stop taking his thyroid medication. The nurse responded with these symptoms. Select all that apply, and you're gonna have 1, elevated cholesterol, 2, low body temperature, 3, muscle weakness, 4, high blood pressure, and 5, peripheral edema. And I'll give you a little time to answer that. All right, I'm going to go ahead and show the answer, and it's going to be 1, 2, 3, and 4. And you can also find that on page 796 of your med-surg book. All right, moving on to the last question. Which of the following assessment findings characterize thyroid storm? The answer choices are A, increased body temperature, decreased pulse, and increased blood pressure. B, increased body temperature, increased pulse, and increased blood pressure. C, increased body temperature, decreased pulse, and decreased blood pressure. And D, increased body temperature, increased pulse, and decreased blood pressure. And I'll give you a little time to answer that. All right, and the answer to question number 5 is going to be B, and you could find that on page 799, chapter 39 in your MedSurg book. Once again, my name is Kaylee Chavez, and my presentation is over hypothyroidism, and I hope you learned a little bit about it, and I hope I explained it good for you. And here's a page of my works cited of where I got all my information from. Thank you.